Thank you, Shar. Could you give me the time for the hard stop because I know you have other things on your agenda?
We allot
Do you
45
have
minutes
any cases
for,
today?
yeah, do we have cases? If we don't have a case, then it gives you a little more time, or in fact, or even more time for Q&A too.
I don't
Okay.
see a case. So 10 minutes too?
Okay. Sounds good. Thank you very much. So thank you everyone for joining us, and it's always good to be a part of this. I feel really honored because I'm not a clinician. I don't have any fancy initials behind my name except ADHD, OCD, which jokingly say it, but it's true. And we live in recovery. Our organization is a national alliance on mental illness, and we share from a lived experience point of view. We also provide support and education, and we are the National Alliance on Mental Illness. And today I'm going to be sharing something that NAMI National, as well as here locally, we've been working on this big project of getting crisis intervention team within our islands. And I'll be sharing that today and how that also intersects with providers, hospitals, clinicians, law enforcement, and people who live with mental health conditions and their families. Okay. So we are the largest grassroots mental health organization in the nation with over 600 affiliates all across the United States. And we provide free programs. Everything we do is free. So if you are a part of a clinic or a hospital and you'd like us to come and share any of our resources with you, we would definitely love to do that free of charge. I am the executive director of NAMI Hawaii. I've been with NAMI for about 10 plus years now, almost 11, and I love it. And again, we are an organization with people living with mental health conditions and families who care for those with mental health conditions to provide free support, free education, free awareness, and advocacy. And what we do regarding advocacy is not only legislative advocacy, but we work on the ground, boots on the ground, grassroots advocacy. And this is what this crisis intervention team does. It not only does it educate and bring awareness, but we are also advocating. And I'll show you how all those puzzle pieces will fit together. All right. So CIT is a nationwide, international actually, program, and it's a team project where law enforcement, clinicians, and advocates come together to prevent handcuffs. We want compassionate care for people who are going through a mental health crisis. We also want to fix the gaps in services. And so this phrase that NAMI picked up called help, not handcuffs, is something that we're really trying to push all across the nation. And our core CIT is made up of 3 leads. One is a clinical lead, Heather Lusk. I'm sure you all know her. She's out there doing amazing work with Hawaii Health and Harm Reduction Center. We have Sergeant Corbin Matsumoto, who's the lead law enforcement. And then I am the advocacy lead in this project. Right. So this is an overview of CIT. It was first developed in 1988. And what happened was there was an African-American gentleman in 88 who was shot and killed by police officers because he had a psychotic episode. Now, there was a huge outcry, very similar to what happened in 2020. Remember that? There were major protests and riots, and the police were antagonized, and it was a very challenging season for Memphis. Now, NAMI advocates like NAMI mommies, that's what we call ourselves, the community members of NAMI went to the Memphis police station and said, we're not pointing fingers. We are not saying you guys did anything wrong. We just want to help. We want to help your officers do the best job you can do. but we also want to help our community members be safe. So that's how it all started. And it was a community partnership with law enforcement, mental health clinicians, professionals, and advocates, such as people living in recovery and their families, giving a voice to this very topic to try to change the system, try to change policies, and provide information so that the officers can provide help, not handcuffs. So the team is really a team, right? So it is a community partnership with law enforcement, mental health, substance use, people with mental illness, their families, and other advocates. And no one owns CIT. It's not owned by NAMI. It's not owned. There's an organization called CIT International who kind of gives us guidelines and educates people. But again, they don't even own CIT. CIT is a partnership. That way, everybody feels they own it. Everyone feels they're part of it and collaborate, and they want to see the system work. And so that is the amazing part of it. I mean, I think I made the slide ordered wrong, but again, this is a clip of how the very first, incident sparked the CIT training and CIT program. So that's the news clipping there. Okay. Locally here in the islands, they used to have another police psychologist who did psychology type training, mental health type training for the police. And he didn't believe in the CIT model at that time. And NAMI was like, we need CIT, but it wasn't really embraced. And then in 2017, when a new administration came in, they said, let's do CIT. What they did was they applied for a grant. CIT, again, all these different communities are doing it, but it's a little bit different. Each community has different things, different ways of doing it. And they kind of follow a format that was standardized by Memphis, the originators, but nothing was structured. So what they did, BJA, government agency, wanted to come and standardize this. And they wanted to give 4 communities a free grant that they'll bring in the top trainers in the whole nation to standardize this, start it up in our community, and teach us the Memphis model. So in 2018, they came in. So we were one of 4 that was awarded. Of course, why wouldn't Hawaii be awarded, right? They came in the winter. They're like, of course they're going to come and choose Hawaii, right? So they came to Hawaii, and but we were well deserving and we were ready. And they helped us create a SIM, which is a sequential intercept model. And I'll share a little bit more in a future slide. And community building. So helping us to find partner agencies, government agencies, hospital leaders, clinical leaders, law enforcement leaders to come to the table to begin this process. After we did this mapping of what are the gaps in services, right? We're finding out what the problem is. Then we held our first CIT training. They trained us. Then they trained us to be trainers. And then we went and did the actual training ourselves. And you see in this picture here, there's a gentleman in the blue shirt with the red tie. That's Sam Cochran. He's the founder of CIT, who started this in 1988. He's since retired, but he's still alive and active, but just an amazing guy. So he was the founder. He came down in 2018 to train us. So these are the core elements of the Memphis model, is that, again, this is a partnership, and it's not owned by any agency. It's a community ownership. We follow policies and procedures that are suggested by CIT International, but the steering committee will really set the procedures. We have officers, dispatchers, coordinators who come to this 40-hour comprehensive training. And so they come and we teach them things about mental health. We teach them things about how to identify a crisis happening, how to how to de-escalate a situation. So instead of saying, drop your weapon, which was the first response that officers were originally taught to do. If somebody's holding a knife, they're cutting an apple, but they're in psychosis, and you tell them, drop your knife, they may not understand that, and they may be shocked, right? But if a CIT officers see this and they see this person's not able to comprehend, they can use words to de-escalate instead of force. And so those are tips that we teach them. So we also work with mental health receiving facilities, EDs, and ERs, and we do some evaluation and research, extended advanced training. So we will have our second set of training happening in March, April. We're having our next training of trainers for this program coming up. We also recognize and honor special officers each year at the Mental Health Mahalo Awards, Mental Health America Mahalo Awards, who is one of our partners. And then we also work to develop CITs in other communities. So we did that for Hawaii County, Big Island, and now they're thriving. So they're in their second year, and they've already trained 31 officers. So, this year they trained 31. So I think total is 50. I'll give you more data as we go. Okay. So these are the goals of the program of CIT, is that we teach officers compassionate and effective responses that's least intrusive to the person's life. So we don't want to arrest them. They don't need to be incarcerated. They don't need to go in and out of jail. Let's find the compassionate and most effective response, right? And we want people to get treatment, not jail, not the justice system. So these are our ultimate goals. But also the benefits of CIT is that it not only helps people in our community who are going through these mental health crises, right? But we also know that it gives officers the tools to not have to draw their weapons, because every time they draw their weapons, they have to go off duty. They got to go counseling. They have to go through a ton of paperwork, and they got to get, I can't remember the system, but they get an interview, make sure, did they do everything correctly, right? So we don't want more work for the officers that are unnecessary, right? And then we saw reduction in officer injury, because every time an officer has to go in and jump somebody or tackle them or arrest them, they're putting their bodies, mind, spirit at risk of injury. So not only are they possibility of physical injury, but mental, emotional injury as well, right? Because a lot of times that's a lot of trauma on these officers. It also lets the officers stay focused on crime, because these mental health calls can be treated quickly. Oh, we see that they have a mental health crisis. We don't have to arrest them. We get them the help. Maybe we call 988. Maybe we ask them to go to the ER. So that way, boom, the officers could go right back into doing what they're going to do best, which is keeping law enforcement in check, right? And very cost saving, because if we're getting people who have serious mental illnesses out of the system, we're saving tens of thousands of dollars each year. Each time somebody goes to the emergency room, I'm not quite sure what the statistics are, but I heard from another person who works in the emergency department that every time somebody comes through their system, it costs them several $1,000s for one time. So if somebody with psychosis who's houseless, they come through this, another couple of thousand out the door, right? But if we are getting them the treatment that they need, we're getting them the help that they need, we're going to be saving hospitals money, our state money, individuals money, everybody money. So we want to get people help. And we also, again, know that officers are going through this system of stress, trauma, vicarious trauma, compassion fatigue. And we know that mental health conditions affect officers as well. We know that officers and medical professionals can complete suicidal situations, right? Self-harm more effectively than the rest of the population. and it's not discussed very often. So we know that people in the medical community, officers, there is a higher rate of suicide, and we want to make sure that they're cared for. We want to make sure that they're not going through this vicious cycle. And so part of what CIT does is we are teaching them wellness. We are teaching them how to build resilience. So it's not just teaching them how to interact with somebody in a mental health crisis. They have to learn it for themselves too. So that's also a big part of the training that we do. So this is the sequential intercept model. And when we did this in 2018, there were so many gaps in services. For instance, when somebody has a mental health crisis, there was jail or emergency room. That was it. But now you know, right? We have these respite centers. We have walk-in clinics. There are so many more options. 988 is doing an amazing job. So we are fixing the gaps in services. Part of that was, of course, government and wonderful agencies that stepped up. But I'd like to believe it's because the CIT is bringing everyone to the table, everyone to the conversation, so that we can say, oh, I can help with that. Or like we had a situation happen, and then we know that a forensics chief sits on our committee. Oh, I'll take care of it. Boom. Somebody from the mayor's office goes, yeah, I'll deal with that. Boom. Whereas before we kind of had to beg and nobody would see us or hear us out. CIT brings everyone to the table, so things are happening a lot quicker. And this model was done last year. Oh, Kathleen joined us. Kathleen's part of our CIT committee. And she's one of our trainers. Wait, when she comes in, I'll elevate her. Kathleen is also, hi, Kathleen. She is an amazing CIT presenter, and she's one of our champions. But there's so many of you possibly on it that I didn't see your names that might also be on our steering committee or some of our trainers. But as you know, we're starting to slowly fill in the gaps in services so that eventually everyone who goes through a behavioral health crisis will have a place to go outside of ER, outside of jail. We want to have all different options for them. So that is our goal. So how do we get this to work? So CIT, the basis of CIT is to train our officers and law enforcement. But again, it's a lot more than that, but that's where it started. And it starts with a different mindset, changing the way officers see people with mental illnesses as a person, not as a criminal, right? We want them to, like, for instance, if an officer is dealing with a potential criminal, the first thing is sit down is their first response that they were taught. They were taught to control the situation with yelling, authority, dominating. That was the old school. Now, what they're being taught now in the academy, and again, further emphasized through CIT, is that you could say, sir, we would like you to sit down. Would you like to sit here on the curb, or would you like to sit over there on the grass? You're getting the same outcome, but instead of using force, instead of yelling, instead of commanding, we're asking them, sir, would you be able to sit down here or there? You're going to get the same response, but more compassionate, in a compassionate way, right? So we're teaching officers to change the way they see and do things. And then how do you do it? These are the guidelines. And again, I'll share these slides with Shar afterwards, so that she can forward them to you if you so need them, or you can reach out to us as well. But one of the things is we want officers, of course, to maintain safe distances, but clear tones, quiet, lower tones, not yelling, not, that's what officers used to do, right? They used to have to go, yeah, command, right? But now we're teaching them to take the tone down and talk to them with compassionate voice tones, right? We also teach officers. Some of these guys are like 250 pounds, 6'6" guys, right? And we're teaching them, sometimes you need to squat. Sometimes you need to get down to somebody who's suicidal. so that they can see you eye to eye, right? So that they know that you're not there to threaten them, but you're here to help them. And then active listening, building hope, and also demonstrating compassion. And then we also teach a thing called connect, then direct, right? Connect, then direct, which is find that thing where you connect with them. So we ask them to remove distractions, um, using I statements like, I care about what's happening, right? I would like to see you come down off of that rock. I would like to see you sit down so I can help you, right? I care about you, right? And then being in the here and now, which means let's not talk about when they were 5 years old and their mother didn't give them their pet puppy or whatever. It's no, let's talk about right now. What is going on right now? Tell me about it. What's happening right now? And then making no promises that you can't keep. So sometimes people will say, I'm gonna jump because my boyfriend left me. We never say, well, we're gonna get your boyfriend back. No, we can't say that. We can say, we care about you. There are other people who care about you. Who is it that we can call for you? So never make promises you can't keep. And again, sometimes they're overwhelmed with sounds, thoughts, especially if they're going through psychosis. So we teach officers to keep asking them, can you hear me? Can you understand me? And if they go, oh, I can't hear you because I have other voices, then say, is my voice louder than the other voice? So there are these little tips that we teach officers to keep that connection going. So connect and then redirect. So this is active listening that was created by FBI. So we do active listening. I know a lot of you behavioral health specialists do that, right? And then we practice empathy, build the rapport, and then we influence, and then we affect change. So, this is something that all therapists have to learn to do, right? When you're in school, it's like you listen and build that rapport, and then you affect change. So that's what we're again teaching our officers to do, but we teach them to do it on the field. So again, we're going to go through some of the steps that they have to do. They always need to introduce themselves, ask for the person's name, express to the person what you are seeing. I see that you are hurting. I see that you are really upset right now, right? I see that you're not happy right now, right? Tell me more, right? And so active listening is using I statements, saying, I see that, dot, 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 and then asking a question that doesn't result in a yes or no, but asking a question that has them give a sentence as a response. What is it that you're hearing? What is it that you're seeing? Tell me more. And this is a footage. We blocked out the person's face, but this is an actual footage from an officer's body cam. And they had to talk this one young lady off of the balcony. I saw this video clip and it was very intense and very traumatizing. But what she felt like life was ending. There was no reason to live. And the officer yelled out her name 50 times. Okay, let's say her name was Susan. Susan, 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 Susan. So he didn't have any CIT training. So he was just doing whatever he could to just keep her from jumping. Okay. Eventually they did get her to come off the ledge because they had her father come and she didn't want her father to see her jump. So she eventually climbed back in and they were able to help her. Now this officer took CIT training because he was so traumatized by this event. He said, I didn't know how to help her and lucky I was able to, but I didn't have the tools. I was just flying off the seat of my pants. And then he shows another video clip with his body cam after he got the CIT training. And he used all the tips and tricks and it just goes so much more smoothly, so much more quicker. And they were able to talk another person off the bridge with all the tools he learned through CIT. And that is why we do it. And officers will, these tough macho officers, why do I need to learn mental health? But you know what? When they see these CIT officers be able to work their magic and talk someone off a building, talk someone off a ledge, they go, oh my gosh, I want to learn that. And that's why they come. It goes through the grapevine, a coconut telephone or whatever, and they word of mouth. They want to learn these techniques as well. And these are some things that officers have told us that in their 13 years as a CIT officer, this was the most impactful training I have ever attended, right? That's amazing that they learn all these skills. And many officers will tell us. So usually day one, they're all like this, they're all these tough dudes and tough girls, ladies who are officers. And then at the end, they're all hugging all of our NAMI people and all the trainers and saying, oh, this was so powerful. Thank you. This helped me so much. Thank you. So, we really see an amazing change in our officers as the days go on in the 1 week training. Here's another quote. I see things way different after going through CIT training. I now see people, not just problems. And this is in response to one of the training modules. We bring in our family members and our people. We call them peers. We don't call our people with mental health conditions consumers anymore in our NAMI community. We call them peers in recovery. And these peers will come in and share their personal stories of recovery. Many who have had an interaction with law enforcement. And I'm going to just tell you one amazing one was we have a presenter who comes in regularly to do these officer presentations. And he said, I was at a shopping mall and I was having psychosis and I just didn't know what to do. So I just, the officer says, don't move, but I disobeyed. And the officer jumped me. No, he didn't get hurt, but jumped him and took him in to get help and got him into treatment. And this kid got training, became a certified peer specialist, became a NAMI advocate, training at these police officer training. And then one day we had an officer go, that was me who did that for this young kid 10 years ago. And it was like a full circle moment. We're all crying. Like, if it wasn't for that officer who helped this young man get help, he wouldn't be where he is today. And now there's a documentary that's going to be coming out next year about this guy. So keep an eye out for it. His name is Clint Oka, but amazing guy. He's won the Mahalo Awards. He's been on the news, just an amazing young advocate for NAMI. All right. This is something a family member had said. So family members often tell us that they don't want to call the police because they're scared, or their son is, or their daughter is afraid they're going to go to jail, or they're scared of the officers because they got bullied or they were talked down to or whatever. And now I hear over and over and over and saying, thank you for working with the CIT, because we had to call the officer and they gave us a compassionate response. They were kind to my son. And this NAMI family member said, the CIT officer said, hey, young person, if you take your medication, I won't take you to the hospital. He goes, okay. And he took his medicine, so he didn't have to go to the hospital when he was going through a crisis, right? Then the officer came back and checked in on him every week to make sure he was taking it. What a kind officer. And they had built a friendship with that community officer. So these NAMI families, these NAMI peers living in recovery feel safe. They feel like the officer is their friend. And that's what we want. We want to get them help, not handcuffs. Right. So this is some of the statistics since as of the year end. In Honolulu, we have trained over, 247 officers to date. That's pretty amazing. And so right now we're at about 50% of all officers. So we have at least one CIT officer in every district. And also the I forgot what they're called, blank mind, but you know the one they call 911, those operators, they have a whole list of who are CIT officers. So if you request a mental health crisis or request a CIT officers, they will look and recommend a CIT officer to go and do that call. So, you know, we have CIT officers readily available in our community. Also, because of the value it has been doing for our community, now NSA officers, FBI, can you believe it? FBI are coming and asking us for help, right? And we're like, FBI created some of this stuff, but they want to learn more on how it relates to mental illness, right? Veterans, officers, Navy officers, so many other law enforcement are asking for our help. So we've been doing a lot of training. The next training that's coming up in Honolulu is the last week in January. And I'm going to invite you folks. You are welcome to attend and observe the whole week if you'd like. All right. Hawaii County, there's 55 that were trained and 31 in 2024. Also, yeah, total of the math doesn't add up. But anyway, CIT has been growing in Hawaii County. And because of the efforts that they've started since 2022, I don't know if you've seen all that they've accomplished by year end of 2024. They've had mental health summits. They've created a drop-off center. They're creating all of these amazing partnerships in Hawaii County because of the CIT efforts.
Is it only in person or is it available via webinar?
CIT is only for law enforcement, and it is a 40-hour in-person training. And because you have to do the scenarios, you got to do the active role playing. However, we do little workshops for different law enforcement communities. Like we've done it for Maui security officers, or we've done it for, you know, different smaller agencies. We've done it for adult human protective services. So we'll do small mini workshops, and those we can do on Zoom. Okay. Maui and Kauai, they have their own CIT that they've been doing Honolulu. So they've been doing it a lot longer than we have. They hire outside people to do it from the mainland. So, you know, we hope to partner more with them as we go forward. And NAMI does partner to do the peer and family panel for Maui as well as Kauai. So they do have Dr. Dara who comes in to teach some of this. I think Dr. Alicia Rodriguez also helps with Maui. So they hire clinicians to do it, whereas ours is the real Memphis model where we ask like Dr. Chad Koyanagi to do one. We'll do the Dr. Michael Champion to do one, and we'll have you know, the veteran specialty to do the veteran one, and Connie Mitchell to do the homeless one, things like that. So these are the benefits to the providers, that's you folks, is that we're decreasing gaps in services so that as we're training our officers, we're building these partnerships. As we're building partnerships, we're fixing the gaps. We're creating safe places for people to go. We're connecting with other nonprofits, other hospitals, other clinics, and trying to figure out how we can partner. And we've seen tremendous growth, and we will see more in the near future. As I understand that, I believe there's going to be statewide funding coming up for this program from the governor's office, hopefully. So in 2026. So, you know, we're seeing this happen. Magic is happening. And more people are getting the services they need. We're getting less MH1s. We're getting less people to the ED visits. We're reducing recidivism. We also are starting an assisted community treatment program. Connie Mitchell and Hope Services on the Big Island have started the houseless community assisted community treatments. But we also are working on some for families, not just people who are off on the streets who are houseless, but people who are in and out of jail, in and out of the revolving door. We want to get them to stick to treatment in a compassionate way. So these are projects that came out of CIT. And then more awareness for people to call 911 and to ask for a CIT officers. So people go, I want to talk to my neighbor who's screaming and yelling, but I don't know what to do. Did you know you can call CIT for a CIT officer? I go, what, really? And they call 911, ask for a CIT officer, and are able to get them help. Also, people with SMIs are less fearful of officers. We want people in our community to feel safe, that they know that they can ask for help if they need it, and the families can ask for help if they need it.
We've got a question about if any of the CIT training's been done for jail and prison staff.
So we have done some, again, we do a shortened version of a seminar for them. So we just did Halava, and that was the only one that we've done for jails. And we're working with BJA and SAMHSA to do something well, they're going to do it nationwide, but our CIT team will do it in Honolulu, where we're going to be offering our services for any government agency, any type of law enforcement, any government agency who wants this. So that might be 2025 or 2026.
Anything going on Molokai?
Molokai, we're in CIT. I believe there's one officer trained on Molokai who was trained at the Maui CIT. But again, that's just from what I've heard through the grapevine. But we would love to do something more in Maui. So if you are Molokai, if you're over there, we would love to connect with you, because NAMI, we're trying to do more awareness events in Molokai. We just found a leader there that might be able to promote many more of our programming, but we need you, people who are there, partner with us to get the word out, get programs in. If you want us, reach out to me. We'll go. We'll fly in or Zoom. We will help you. So just, I'm almost done, and then we'll go to Q&A, okay? All right. These are our partners. Again, many, many more. And again, we will share these slides with you at the end. How do you get involved? You can join our steering committee. Anyone can join, as long as you're a community member, a leader, somebody in a specialty field. If you want to be a trainer, if you want to learn how to be a trainer, we're going to have training in April. And so you can go to a 2-day workshop to become a certified CIT trainer. We also need people who have lived experience stories, and we will train you to share your stories. We have a NAMI National Signature program that teaches you how to be a presenter. But there's so many ways you can get involved. Contact me, Kumi at namihawaii.org. One more thing is that because of the high demand for this topic, we are going to have a very intensive, very thorough conference on this topic, March 24th. Included in this, we will have the ACT, Connie Mitchell, Dr. Chad Koyanagi is going to be there. We're going to have some national presenters. We're going to have the local people who are doing it. We're going to have the CIT lead members come and present how we get this going in our community, the positive stories, and what families can do and clinicians can do, all of that wonderful. Everything we do is free. So save your date. And if you want to be notified of this conference coming up, you do need to be on our email list. So again, email me or our general info box, but you got to let me know so we can let you know when registration opens. Again, it's free lunch at Prince Waikiki Hotel. It's a nice hotel, nice lunch. So we want you to come, okay? And there are some free resources. Again, free programs, support groups, classes, presentations for youth, all the way up to veterans, family members, individuals with mental health conditions. So all of these are free. Check us out on our website. And this is our last slide. If you have any questions or comments, we are available at namihawaii.org. And I'm going to stop sharing so I can answer some questions.
All right. What questions do people have? Wonderful presentation, as always.
Oh, you're sweet. Thank you.
Kumi's awesome.
Oh,
He's already given us a topic for next year, even. Um, so we had the question about Molokai. What's the difference between calling 988 and calling 911 and asking for a CIT officer? Good question.
Excellent question. So 988, you're going to talk to someone who needs mental health crisis intervention, crisis services, whether they need help just calming down. Even if it's not a crisis, you can call 988. So if they're just having anxiety, I just need someone to talk me down, calm, they can talk to you absolutely free. You can call them for just information, absolutely okay with that. But 911 is when they're in imminent danger to self or others, right? It's like someone's going to hurt themselves. 988 can't handle that. They need to call someone who can handle that imminent danger to self or others. So if they're violent or if they're threatening to hurt themselves, if they're hurting someone else, call 911. Absolutely. And sometimes 911 will call 988 and 988 will call 911, but they will work in partnership.
Right. Other questions? Should we recommend the Hau'ula training to folks on neighboring islands, or do you expect the conference? Or
we would welcome neighbor islanders, anyone to join us. Right now, we do not have funding for inter-island travel because again, we're a free organization,
right,
nonprofit.
Rural Health might have some.
Yeah, you can connect us. So if they can even help just to transfer people here, that would be amazing.
Can you send me an email with the flyer?
Yes.
And then I'll make the connection. Can you another question for you? Can you briefly explain how the ACT process works? Some may not know.
Okay, so assisted community treatment is where somebody who is in and out of the system, jail, hospitals, and they're not sticking to treatment, and they're in and out, usually with either bipolar with psychotic episodes or any type of psychosis is usually a good candidate. But these are people who are not adhering to treatment. And as soon as they come out of jail, as soon as they come out of state hospital or their stint in the hospital, they go, your next step is to go to the psychiatrist, get your medicine, stay on treatment. But of course, they go, I'm not going to do that. And they just go back out and I don't need meds. And they go right back out to living their lives and then go right back into the system. And so what we're trying to work on for a compassionate response is that we will have like a mental health court, a judge will be appointed right away, streamline this assisted community treatment process. So it involves families, clinicians, a judge, and we also want the family involved. Whereas they meet regularly and it's not forced. We're not forcing anyone, but the judge, because of the black robe effect, is going to put this like kind of pressure on the individual and on all the clinicians and social workers and family members. Hey, I don't want to have to see you next month. If your loved one is not on treatment, you got to go chase them down and take them to their psychiatrist. Why did the social worker, we gave you a budget to Uber them into your clinic. Why did you not Uber them? Oh, we forgot. No, we can. I know you social workers are overworked, but part of that is that we want to get more funding for you folks. That's the goal. More funding, better pay for you folks, more people who are willing to do this type of work. So it's not your fault. I know it's not your fault. You guys are overworked, underpaid, undervalued, but we want to change that system.
That's so funny, the black robe effect and the white coat effect,
Yes, exactly.
Similar.
Same thing, right? There's some kind of power when you wear that. Yeah.
What was the date in March again for the Hau'ula conference?
So it's March 24th. It's a Monday, and it's going to be around 9 to 3. We don't have the specific information yet because we're still waiting for some more details to come through. But it will be March 24th on a Monday.
I probably shouldn't say this, but if you want to give conferences like this, JABSOM is a pretty nice place to do it. I found out last September, and there is a staff that coordinates everything. So yeah, let me know since you're, wonderful trainings.
Oh, thank you.
Does anybody have more questions, or does anybody want a follow-up on a case or advice on a brief case? Remember, you get $150 for each case you present. And this is the last time all year, all 2024, for you to present a case. So hard for me to be quiet, but I'm really trying.
Even if you have a case, Kumi, of like a recent peer that you helped, or just a background in history and ultimately what services you were able to provide, if there was a positive outcome or a solution at all, that would count as a case presentation too.
Wait, you want me to just share a positive story?
No, or
Sure.
just a positive story, or just like how you shared about the police officers that were trained, if there are any touching stories like that, and how the NAMI services were able to help them, or even a trainer that went through your training that gave you a testimony about it working, or the kind
I
of
mean,
work
I
that
hear it
you.
all the time from officers how they were able to
Oh,
talk someone off a ledge or even at their home, they go, "Oh my gosh, I just went home yesterday and it worked on my teenager." The de-escalation. So these tips work for anyone, but um I can't think of a big story except the ones I shared in my presentations at this time, but I'll share something that happened this morning. I had a caller who said, I have a loved one who lives in Maui and they are manic right now. They don't want to go to treatment. They don't want help and they have to go to court in a few weeks. I don't know how I'm going to get them to court. I don't know how to get them into treatment. So then I said, well, first of all, go to our website, namihawaii.org. There's a book called I Am Not Sick. I Don't Need Help. And this is a step-by-step instruction booklet that kind of goes over the same principles as what we teach our officers. Listen, empathize, agreed, partner. They just use different acronyms, but written by, like, he was working for the Obama administration. This psychologist is amazing. So go to our website. You can get a free download on the communication chapter. And this is not a NAMI book. It's just a really good book that we recommend. So she goes, okay, I'll look at that and then learn those skills of how to talk to your loved one. Then contact our NAMI leader on that island because she'll know more local resources too. Next is join the support group because you're going to meet other families that are going through what you're going through. And then you can pick tips and tricks off of them and hear from their group wisdom. And that's what NAMI is about. Um, and then and then she was like crying on the phone, like, oh my gosh, thank you so much. Thank you so much. And this is what we do. Like we give people tools, like you're not alone. You got a community that will help you. So we have an affiliate on all 4 counties. And sorry, Molokai, Lanai, we are here to help you, but we have to do phone or Zoom.